Hey guys, welcome back to Defeating Hair Loss. My name is Steve. Today we're going to talk about what patients are most likely the ones at the top of the list that are going to need a second surgery. So let's start off by saying, again, that we tell everyone to plan on a second procedure. I make sure it's clear in the beginning of the consultation, in the middle of the consultation, at the end of the consultation, the day of the surgery, in all the disclosures, always plan on a second procedure. Plan on a second procedure. That doesn't mean you're going to need a second procedure. Now, there's two different ways to look at a second procedure needs, and that is, do you want more density in any given zone, or do you have two zones, let's say the front half of the head and the back half of the head, that we need to address in two separate surgeries? So for this video, we're going to talk about the same zone. So number one, all females, I'll say that again, every single female that gets a hair transplant should absolutely plan on a second procedure. Why? Well, it's a compliment. Females are articulate for the most part, almost all of them. They're getting a hair transplant most likely in their hairline, because we're not going to do hair transplants on diffuse thinning females. We're going to do hair transplants on females with male pattern, and that is a possibility. So about 5% of who I talk to out there qualify for a hair transplant. Once they qualify, they want their hair exactly the way the higher hairline is, but just lower. And that's not possible. We all know that. So, two procedures. These women, they have the beautiful clothes, the jewelry, the makeup, so they're not going to settle for anything less than perfection. And we all know that that's not possible in hair transplants, or at least in one hair transplant. So all females are going to need a second procedure. Number two, all people with crowns. Now, we've gone back and forth over the top with my crown fetish, if you want to call it that. I've done many videos out there talking about the limitations of getting hair transplants in the crown. I'm not against it. I'm not trying to talk you out of it, but it's a helicopter view. The hair has to be shingled in a pattern which is different than the hairline. So if I didn't warn you out there, and we did both the hairline and the crown, 12 months later, you would say, man, the hairline changed my life, Steve. I look like Bobby Dunlap. I'm looking amazing. But the crown, it just didn't grow in. What's going on? Or it didn't grow in that well. And the answer to that is that it's just a little bit of difference in what I explained to you. So you're definitely going to want to plan on a second procedure, especially if that's the only area where you're working on. For instance, a school teacher that's up at the blackboard or the whiteboard, whatever it is these days. They're going to always, their problem is that they're turned against the students, and students are tough. So they're always busting them on their bald spot, so they want it all filled in. That's going to take two procedures. Young men, now think about this. If you're 25 out there, I was 19, 18. None of my friends had hair loss. I was the only one. So that wasn't cool. And I want to look like my friends. I mean, who doesn't, especially if they don't have hair loss? So it's going to take more than one procedure for that to happen. So young men, I'd say the odds of them, if they can afford it, to do a second procedure is upwards of 80%. Number four, dark hair, light skin. Again, let's just use for this video a Pacific Rim Asian male patient that has pale ivory skin and jet black hair. There's no question about it. Even as good as that hairline is done, and as happy as they are with the uniformity and restructuring of their facial expressions, they're going to want it thicker, because that white skin is going to show through those single hair grafts in the hairline. So all dark hair, light skin. And the last one's kind of interesting. Number five. I guess this applies to everybody. I shouldn't, point out this or that, but you see these guys in the gyms, you see these guys, and I'm talking men, that are like the handsomest guys in the world. They're like so good looking. You're like, man, guy has great genes. They have a little bit of hair loss, not a lot, and they get the hairline done. Like the women, and I said they're articulate and they're perfectionist, so are these guys. And it doesn't matter what age. I actually just spoke to someone today that was 49 years old, and he don't need a hair transplant. He wants a hair transplant. I go, be prepared, because now you're setting yourself up for two. And he was asking me, what are you talking about? And I said, listen, if we do your hairline, you see that hairline now? Well, that transplanted hairline is not going to be as dense. And you have dark hair and light skin. So he's actually in two categories. The only advantage he has, a little bit older, you don't have to worry about him going bald, even though he's getting on the medication. So if you are I don't know if this is the right word to use, a little on the narcissistic side, a little on the insecure side, a little like I want to look the best I can side. Guess what? It's not a bad thing. All right? You got that body, you got the six pack, you want the hair, plan on doing it twice. That's a fact. Don't forget, remember I told you so. Don't forget to like and subscribe.